Welcome back. The week ahead continues. Now, we know that Health Minister Doctor Aaron Motsoaledi announced that the planning for 3 new district hospitals is in the very early stages. And during his budget vote address in Parliament on Wednesday, Dr. Motsoaledi announced that the new central hospitals, they planned for Mpumalanga province, the Northwest province, as well as the Northern Cape. The minister said that the 3 new central hospitals, they're all part of the plans to address the chronic overcrowding at healthcare facilities in South Africa. He also stated that the overcrowding of the strain, they're due to growing population and not necessarily due to foreigners seeking medical assistance. But the Health Minister is going to be joining us now to chat a little bit more about what's coming to the fore and answer some of our questions. Dr. Aaron Motsoaledi, welcome to the SABC. Thanks for your time at this hour.
Good afternoon, Lizelle. Good afternoon to the listeners and viewers up there. Thank you very much for having me.
Well, Minister, thank you for joining us and for obviously availing yourself to some of the questions. So we've heard, the remarks, we've heard the plans. Perhaps just outline them for us from government standpoint, expected to be seeking loans from both local and international financial institutions. Talk to us about, those plans for these yet-to-be-built facilities.
Yes, Lizelle, I can see on the screen there, it says government to build 3 new hospitals. It's not 3. We are going to build many.
Okay.
The difference between the 3 that are in Mpumalanga and Northwest and Northern Cape is that they've never had central hospitals. The biggest hospital, which we call central hospitals, where medical students are trained, are 10 in the country. And they are very big. Grooteskier, Tygerberg, Chris Hani Baragwanath Hospital, Steve Biko, Charlotte Maxeke. There are 10. 4 of them are in Gauteng, 2 in the Western Cape, 2 in KZN, 1 each in Eastern Cape and Free State. Mpumalanga has got nothing, not at all. Limpopo has got nothing, but we have just started building 1. It is 26% completed. Northwest has got nothing. Northern Cape has got nothing. So because the Limpopo one has already started, we have already started construction, we are at 26%. That's why I didn't count it. I'm counting Mpumalanga, Northwest, and Northern Cape. In other words, in provinces where there was nothing. But the reason that I'm saying these are not only new hospitals that are going to be built, is that even in provinces where there was something, that something is not good enough, is dilapidated. There are 3 medical universities whose teaching hospitals are completely dilapidated. It is King Edward the 8th Hospital under the University of KwaZulu-Natal. It needs to be rebuilt from the scratch, not refurbished, a totally new hospital, but bearing the same name. The second one is Sefako Makhado, George Mukari under Sefako Makhado Health Sciences University here in Tshwane. It is also completely dilapidated. And in fact, it has never been built. We're using district hospitals that are dilapidated. The third one will be Nelson Mandela Academic Hospital under Walter Sisulu University in Mthatha. Those ones exist, but they are not lookable. They are not appropriate, even for training of doctors. So we have got to build them from the scratch. So you can see that the total of academic hospitals will be 6, but the 3 is because they've never been there before. But I see you still have it on the screen.
Yes, so Minister, I want to actually thank you for that. I do know that the system is going to be rebooted and we'll update there, but thank you for just clarifying that and giving us that context. Because, obviously, just to your point about the need for those central hospitals, given the historically, under-prioritized areas, but also rural areas, the services that are needed. But, if we're looking to the issue of overcrowding as well and healthcare services, it's become a controversial issue here in the country. And I wonder if you could talk to us about, these new hospitals, how they're going to be addressing the issue. Perhaps give us a sense of how dire the situation is in regard to overcrowding and why government's now seeking these alternatives to prevent problems for the near future and beyond.
Yeah, well, Lizelle, 86% of the South Africa's population is using private health care. 86%. Are using public health care. 86% of the population is using public health care. 14% are people with medical aid and who are well-to-do. They use private hospitals that are well-equipped, as you know. So the 86% that is going to public health hospital, they arrive there to find fewer resources, both human, financial, and other material resources. And that's why there is overcrowding. So the only way to solve that overcrowding is to give them more resources, not to push the resources to private sector where there are few people. And that's why I was complaining of the 70 billion rand subsidy that is given to all government employees who are on medical aid, including members of parliament, including the judiciary. That means the cream of the crop are the ones who are being subsidized. And I was saying that money should go to help the public sector where 86% of the population is getting their services and getting overcrowded because of sheer numbers. Even the public protector went to, I'm sure you might be aware, Lizelle, about the Ginza Hospital in Gqeberha, in the Eastern Cape. It's always in the news.
Yes.
It's always on your TV, where pregnant women are sleeping on chairs and on the floor and all that. The public protector went there on her own accord to investigate, and she reached the same conclusion as us, that we need to build new district hospitals there to help it, because the overcrowding is because of a large number of people which the hospital simply cannot afford to carry.
Well, Minister, to your point, the need for universal health care coverage is obviously, growing, and we're looking at the rollout of NHI in our own country now that the bill has been signed, the pace at which this is all unfolding. In relation to that, what does the building of these facilities mean for NHI and for the rollout? How are you also engaging with the different stakeholders, healthcare practitioners as well, unions, people on the value chain?
Look, there are people who say they support universal health coverage. Actually, all the court cases against us, the people who lost those court cases in their affidavits, Lizelle, they start by saying they are not against universal health coverage. They want it, but they don't want this NHI because the public system is not ready. It doesn't have enough doctors. It doesn't have facilities. It's not prepared. So we told them that they cannot deny people, because NHI is a healthcare financing system that balances, equalized between the rich and the poor. They cannot refuse the poor from being equalized, from getting good quality healthcare services on the basis that we are not ready, because we do have plans to get ready. And I was reading these plans that while we are talking NHI, we are not just shouting NHI and folding our hands. We are planning massive infrastructure to accommodate a lot of people, because NHI is for everybody, the rich and the poor. And the poor, as I've told you, are already using public hospitals that are overcrowded because of sheer numbers. So it will be very important to prepare for them. But secondly, Lizelle, I emphasize that one of the biggest differences between a private hospital, which everybody cherishes to be in, and a public hospital, is because public hospitals are not given facilities. But in terms of clinical skills, they are very good. And one of the proofs I can give to you is that during the complaint about Helen Joseph Academic Hospital, that complaint that was given to the health umbud, to the National Health Umbud, were 7 complaints. 5 of them were about clinical care. And the health umbud dismissed them and said there's nothing about clinical care there, meaning the knowledge of doctors, what they must do to treat the patient, etc. He said there's nothing wrong. The 2 complaints that were upheld is about infrastructure and the human resources in terms of the number of people. So those are the issues that we want to correct. And that's why we are announcing a massive infrastructure program. The third thing, NHI or no NHI and all the things I've mentioned, the fact remains that if we don't put this massive health infrastructure now, we are going to arrive where ESCOM has arrived today, Lizelle. You may be aware that ESCOM was advised by experts some years back to build more power stations because the population is growing. And that call was not heeded. and it results into massive load shedding, which we're still trying to resolve up to now. So we don't want to reach a situation where, because of the growing population and the number of people who are using public healthcare services, one day we found that everything, everything is much worse than what it is today because of lack of infrastructure. Quite a number of young people, Lizelle, who have just got jobs are not joining medical aids because they are too expensive. Many young people who get a job now, they don't join a medical aid. And when they are sick, where do they go to? They go to public health facilities. So they have to find them up to standard.
Well, Minister, thank you for those remarks. I think even if we're looking at back to the issue of funding, the relationship between what's transpired with the UniAIDS funding, the impact it's also had on the fight against HIV and AIDS in the country, the measures that have also been put in place to assist on that front. Talk to us a little bit more about how that's impacted us here in South Africa, how you've managed to close that gap, if at all.
Yeah. Lizelle, let me start here because it's important. I'm making use of this opportunity you have given me.
Okay.
Part of the problem in South Africa, even in Parliament, is that we define health as only that is happening within the four walls of a hospital. The moment you step out of the hospital, they believe there's no health there. There's a lot of healthcare going on out in the communities there, like preventing HIV and AIDS and stopping people from going to hospitals, by PrEP and distribution of condoms, community health workers visiting them at home, etc., by massive immunization, etc. Those things are very important even before you arrive in the hospital. So our fight on HIV/AIDS is not based inside the hospital, as you'll know. The 5.3 million people who are on ARVs to fight this disease called AIDS, they are not in hospital. They are at home. They are like me and you. They interact with us, they are working. So they need to be supported. That's why I'm saying there's massive health that is going on outside hospitals, which in the private sector, of course, they don't practice and they don't recognize. That is a fact, because I've been speaking to them to talk about prevention of disease and promotion of health. We are now spending 46.8 billion rand to fight HIV and AIDS. And that money is not spent necessarily inside the hospitals. Is spent out there in the community to make people stay healthy. So that's very important. And that's why when PEPFAR pulled out, we went to the Treasury. And Treasury now has responded. When we went to them, they said, we must prepare 9 plans, 1 for each province, and then put up a 10th plan for the whole country. Then they came up and say, also put up a plan for researchers, because there's a lot of research that is going on in our universities and research institutions by our researchers to help us, guide us in which direction we must move on HIV and AIDS. So Treasury has now come to the party. They have given an amount of 750 million rand, which is divided, 753 million, which is divided into 3 parts. The first part, 590, is to go to the provinces for HIV/AIDS service delivery. The second 132 million is to strengthen medicine dispensing and pharmaceutical supply management process at national level. And the other 132 million must go to the researchers who are involved in HIV and AIDS research.
Okay, well, Minister, thank you for speaking to that. I also want to get into some of the other issues, particularly when it comes to data and facts and figures. So I'm just going to ask you to perhaps also just be aware that we invite callers to also be part of this discussion on our line. And we've got a caller from Gauteng who's like to chat to you and weigh in. Brenda, I believe you are joining us via telephone, and the Minister is aware that you are obviously going to be posing that question. Short, succinct, to the point. Let's hear what you have to say.
Good morning, good afternoon. Good afternoon. So sorry, when you're an elder, you miss the time of the day. And to the Minister and the Motsoaledi, and to our viewers of SABC. Through you, Minister Motsoaledi, it is really inconvenient for us in the deep south of Johannesburg We are sitting with 3 public, provincial clinics, of which the one was about, say, 5-6 years ago in Finetown, and the other one is in Extension 8, and the other one is in Extension in Lowly. What we are facing, we are sitting with our doctors. It is frustrating. This is the poorest of the poorest community in the deep south of Gauteng. And we have sent complaints to the minister's office, to the president's office in March. Then we were directed from the deputy president's office. We have to speak to our premier. Up until today, no response from anyone. Our people have to travel to Barra. There's more pensioners, unemployed, and the services is pathetic at the moment. We are not blaming the employers, the employees, but I feel the employer have to also look over to their employers. They are frustrated. We were sitting with a clinic. The population is now so vast. I'm going to quote it as Ward 7, Ward 121.
Brenda,
Ward 121.
I do need to, you're making valid points. I just need you to get to the point because we are limited for time. What's that pertinent question you want to ask the minister?
We want the minister to come and visit and do oversight, to come and see what we are facing, difficulties, ambulance services, taking 6 hours to reach out. We are losing lives and so on. The extension of the Lowly Clinic do not have the resources to serve as a 24/7 clinic, provincial clinic. The other 2 clinics, they are facing difficulties, only one, and there's no doctors available. If the minister can, as soon as possible, come and do oversight and see what we are facing, it's difficult, very difficult for our patients in the surrounding areas and for the nurses, and there's no doctors available.
Okay, Brenda, thank you. Minister, you've heard Brenda's question. How would you like to respond to the additional support that's being requested, that visit as well to what's available in terms of the clinics? Talk to us about what's also been discussed on that front from your department.
Yeah, if you read my budget speech, Lizelle, you'll realize that I was talking about that type of preparation, including the hiring of 1,200 doctors, 200 extra nurses, 250 health workers, the absorption of 27,000 community health workers who are attached to the clinics, but also the construction of more clinics, which I can't mention here because it's in the budget speech and there's no time to mention them one by one. We've chosen areas. Now, I want to reassure Brenda, Lizelle, I don't have to go there to see what's happening. It's not that I won't go, but she shouldn't think that because I'm not going there in person and personally, we do not know what's happening. Number one, we've established an Office of Health Standard Compliance, which visits our clinics to check the standard if they are ideal. That office was established specifically for that purposes. Secondly, we've got a system called HIPS, Health Infrastructure Planning System, which uses the district healthcare system of using numbers of people who visit every clinic. They use the geographic information system. They use the population from State South Africa and tell us that you need a new clinic here. During my budget speech, I've actually said that when I was mentioning new clinics that need to be mentioned, especially around Soweto, because we have seen that Chris Hani Baraka North Hospital is not manageable because of the large numbers of people who are there. And as long as we don't build many more hospitals and clinics around, Chris Hani Baraka North Hospital will remain unmanageable. So I'm trying to say, Brenda, please know that we are looking into these issues. The fact that I did not necessarily visit that place does not mean that there are no plans to solve those problems because we know about them.
What about community healthcare workers, Minister? Thank you for answering Brenda's point. If we're looking at the work of community healthcare workers, are there plans to fully integrate them into the system itself? Talk to us a little bit more about the measures on that front.
Brenda, it has got a history. You are aware that community health workers was not a program that was planned by the state. It just happened on its own during the crisis of HIV and AIDS, when many people were dying, were on their deathbed, they couldn't wash themselves, they couldn't feed themselves, they couldn't put on clothes because they were too sick, there were not any ARVs. Neighbors and volunteers just jumped and started helping. And later, they got recognized by the state as community health workers. But they were coming to the government via NGOs, where they are hired by NGOs and the state pay the NGOs. And the NGOs will pay them whatever they want or whatever they wish. So they were not earning the same salaries. Some of them were not getting even money at the same time. Others were getting a stipend. The government then decided to put them on PESAL and pay them minimum wages. And that happens in all the provinces except in the Western Cape, of course, where they are still hired by community health workers. From there, in discussion with unions, because the unions were fighting about this until they even went to court, where the court say, we have to absorb these people because they've been working for 20 years, yes. So how did go to court about this? We can't hide it, it's true, while we're still talking and negotiating, because they were very impatient. And we realized that they are telling the truth because we need them. We need community health workers, especially if we are to bring AIDS under control or to eradicate it as public health threat by 2030. So the community health workers, because when you absorb them, they become public servants. You can only absorb those who have got matric. And so there are 27,000 of them who have got matric. Those are the ones who, as part of this budget that the Minister of Finance has given us, will absorb them. You'll remember that during the budget speech, we are being given 6.7 billion rand extra to our budget to try and reverse the austerity, Lizelle. The public healthcare system suffered a lot of austerity measures, meaning budget cuts for the past 10 years. And that explains some of the problems that we are experiencing. So that amount of 6.7 billion is to get out of that austerity. And we said as a starting step, as the first step, we need to do 4 things. And one of those 4 things is the community health workers. The other is to start buying hospital linen, bassinets, mattresses, beds, etc., etc. The other is to employ more staff, like 1,200 doctors. And the last one is to pay accruals that accumulated over the 10 years of what you call austerity. So that's basically what we are doing. So all our plans are integrated into each other.
Now, Minister, thank you for speaking to those budget cuts, because you've obviously seen the strain that it's also had on healthcare workers, burnout, fatigue, and obviously just, working conditions, what support's on offer. But to perhaps continue the conversation and as we explore other possibilities, Ngobile from KZN is also on the line. She's joining us by telephone. Ngobile, if you can hear me, good afternoon. Welcome to the SABC. Minister is on the line and is listening to your question. Perhaps just limited to about 30 seconds or so we can adequately make time to respond.
Thank you, Lizelle. Greetings to the Minister Motsoaledi. Thank you so much for all the positive inputs. Indeed, I think there was a need for tertiary institutions and central hospitals in South Africa. So thank you so much. We are seeing the work done. And indeed, most of the population relies on the public health. Perhaps my question is just one. Minister, with the rising in public dependence in the public health facilities, EMRS has been seen to have a huge shortage. What is the plan in terms of addressing the availability of ambulances, particularly in KwaZulu-Natal in the deep rural areas? Thank you so much.
Minister, Ngobile is weighed in. How would you like to respond that availability of ambulances in rural areas?
Yes, Lizelle, we're discussing at the National Health Council every time we meet. The National Health Council, chaired by the Minister, attended by all the MECs, attended by the Surgeon General of South African Military Health Services, and also attended by SALGA, because some clinics are run by metros. We meet and discuss these issues. And one of the instruments we are using about ambulances is the ratio. There's a ratio that has been determined of how many ambulances you need per population. and we are discussing, we are painfully aware that most of our provinces do not meet that ratio, and we are talking every day to them to try and meet the ratio. So it is true that we are also looking into that as part of these preparations.
Well, Minister, I need to wrap up. I know we do not have much time. Just a response from government regarding public health care facilities across the country. We obviously seen some growing tensions in some areas where citizens have attempted to forcibly remove undocumented foreign nationals from clinics. What's the response on that front? What's the data that's also emerging? What's the recourse, obviously, without perpetuating xenophobic rhetoric?
Lizelle, unfortunately, we have got to work up in terms of our mandates and the law, because we are a law-abiding country. The mandate of the Department of Health is to treat people who need health care, who come into our facilities. Our mandate is not to be chasing out people who are breaking the law. That is the mandate of law enforcement authorities. Anybody who breaks the law and do the work that is not theirs, which must be done by police, of course, must be taken to task, and action must be taken about them. And that action